The last time you got sick, you probably did a few things. You took something from a cabinet. You looked up your symptoms on your phone. Maybe you called a doctor, or at least thought about it. The whole system around you, the pills, the clinics, the pharmacies open until midnight, was just there. You didn't have to build any of it. You just used it. Now take all of that away. No antibiotics, no painkillers, no germ theory. No understanding of why bodies break down at all. Just you, a fever, and whatever the forest around you contains. For the vast majority of human history, that was the situation. And yet people survived infections. They recovered from broken bones. They lived through injuries that should have killed them. Someone was treating them. Someone knew what to do. And what they did was far stranger and far more sophisticated than anything we give them credit for. This is what happened when ancient humans got sick. The first thing to understand is that our assumptions about prehistoric medicine are almost entirely wrong. When most people imagine a sick person 50,000 years ago, they picture someone lying in a cave, untreated, waiting to die. The archaeological record tells a completely different story, and it starts with a skeleton that shouldn't exist. In 1957, an American archaeologist named Ralph Solecki was excavating Shanidar Cave in what is now Iraqi Kurdistan when his team uncovered the remains of a Neanderthal male who would become known as Shanidar I. Radiocarbon dating placed his death at roughly 50,000 years ago. When researchers examined his bones, they found something that took decades to fully understand. This individual had sustained a crushing blow to the left side of his face at some point in his youth, likely blinding his left eye. His right forearm had been amputated, not bitten off by an animal, amputated with the bone showing the kind of healing that only occurs when a wound is kept clean. He had serious injuries to his right leg and foot. A degenerative disease was attacking his spine. And in a 2017 reanalysis by Eric Trinkhaus of Washington University in St. Louis, it was discovered that bony growths had formed inside his ear canals, growth severe enough to have left him profoundly deaf. He lived to his 40s. In the Pleistocene, in a landscape shared with cave bears, leopards, and hyenas, with no functioning right arm, a serious limp, one usable eye, and no ability to hear the predators approaching, this man survived to an age considered old for his time. Trinkhaus was direct about what this meant. Without continuous support from the people around him, it would have been essentially impossible. Shanidar I didn't survive his injuries. He was kept alive through them, by others who got nothing practical in return. But if the social dimension of ancient medicine is surprising, what they were actually doing to treat illness is something else entirely. 31,000 years ago, somewhere in the dense rainforests of what is now Indonesian Borneo, a child underwent surgery. Researchers led by archaeologist Tim Maloney of Griffith University excavated the burial in 2020 and published their findings in Nature in September 2022. What they found was a human skeleton, nearly complete except for the lower left leg and foot. The bone at the amputation site showed a specific pattern of remodeling that matched clinical cases of successful, non-infected amputations. Whoever performed this surgery sliced cleanly through muscle, blood vessels, and bone in exactly the right sequence to prevent the patient from bleeding out. The individual survived for at least 6 to 9 more years before dying at around age 19 or 20. This predates the previous oldest known amputation by 24,000 years. The surgical tools were almost certainly sharp and chert, the same stone that can produce an edge finer than modern surgical steel. The anesthetic was likely some combination of medicinal plants drawn from the surrounding rainforest, though we cannot say exactly which one. What we can say is that someone in that jungle 31,000 years ago understood human anatomy well enough to perform a procedure that most people assume required centuries of medical civilization to develop. And after the surgery, the community adjusted. They carried this person. They shared their food. They adapted their movements across the terrain to accommodate someone who could not keep up. And this was not unusual. Among the most extraordinary pieces of evidence is what archaeologists have found inside skulls. Trepanation. The deliberate drilling or cutting of a hole through the cranium is the oldest documented surgical procedure in human history, with confirmed cases stretching back at least 7,000 years. and indirect evidence pushing much further. More than 1,500 trepanned skulls have been recovered on every inhabited continent in a single burial site in Alsace, France. Dating to around 6,500 years ago, researchers found 120 skulls. 40 of them had been trepanned, and the majority of those skulls showed something crucial: rounded, smooth bone edges surrounding the opening, which is the biological signature of healing. The patient had survived the procedure, in some cases multiple times, on the same skull. The most complete record comes from Peru, where over 800 trepanned skulls have been analyzed. A 2018 study examined survival rates across different eras of Peruvian practice. In the earliest period, around 400 to 200 BCE, approximately 40% of patients survived long-term. Over the following centuries, practitioners refined their techniques, adjusting their tools, their cutting angles, their aftercare. By 1000 to 1400 CE, long-term survival had risen to 91%. During the height of the Inca Empire, from 1400 to 1500 CE, average survival sat between 75 and 83%. To understand how extraordinary that is, consider this. When American archaeologist Ephraim Squire presented a trepanned Inca skull to the New York Academy of Medicine in 1865, the assembled physicians refused to believe the patient had survived. At that time, in the best hospitals in the Western world, survival from the same procedure rarely reached 10%. The difference was not skill, it was infection. Ancient Peruvian surgeons, working in open air with stone tools, were somehow producing outcomes that Victorian medicine with steel instruments could not match for another generation, because hospital wards in the 1860s were killing patients faster than stone tools ever had. The herbal knowledge was just as sophisticated, and we have a perfect time capsule to prove it. In September 1991, 2 German hikers discovered a human body preserved in glacier ice high in the Ötztal Alps on the border between Austria and Italy. The man, who became known as Ötzi, had died approximately 5,300 years ago at around age 45. His body was so well preserved that researchers could reconstruct his last meals, his health conditions, and what he was carrying. Fastened to leather bands in his equipment were 2 distinct fungi birch polypore, which modern pharmacology has since confirmed carries anti-parasitic and anti-inflammatory properties, and tinder fungus, which can function as a wound dressing. He carried dried sloe berries with anti-inflammatory effects. He had bracken fern in his intestines, which is used to treat intestinal parasites, and analysis had confirmed he was infected with them at the time of death. His 61 tattoos were clustered around joints, showing signs of arthritis. Researchers have suggested they represent a form of targeted pain therapy, a kind of acupressure practiced 2,000 years before the concept appears in written records. This was not a man who happened to have some plants on him. This was a man carrying a medical kit, organized and intentional, assembled with specific conditions in mind. And then there is the question of teeth. The first archaeological evidence of dentistry is a 14,000-year-old infected tooth from northern Italy, where a flint tool was used to scrape and partially hollow out the decayed area. In Pakistan, a burial site dating to 7,500 to 9,000 years ago contains 11 molars with deliberately drilled cavities bearing the microscopic marks of flint drill heads. In Slovenia, a 6,500-year-old jawbone, which sat in a scientific collection for over 100 years before anyone noticed anything unusual, was found to have a vertical crack in one of the canine teeth filled with beeswax. A nuclear paleoanthropologist named Claudio Tunis, who led the analysis, described it as almost certainly applied to reduce pain from the cracked enamel and dentin. Someone 6,500 years ago gave a man a dental filling. What all of this adds up to is not a history of helplessness. It is something more uncomfortable than that. Every piece of evidence, the survival of the injured, the care for the disabled, the surgical precision, the organized pharmacology requires the same thing underneath it. Not just knowledge, compassion. The Neanderthal child with Down syndrome at Cova Negra in Spain analyzed in 2024, survived years past infancy. Researcher Mercedes Conde Valverde described it plainly. This child could not protect the group, could not gather food, could not offer any practical return on the resources spent keeping her alive. The group cared for her anyway, because she was theirs. We assume that survival instinct is what defines the deep past. Kill or be killed. Take what you can. Leave behind what you can't carry. But the bones tell a different story. They tell us that 50,000 years ago, a Neanderthal group slowed down for a deaf, one-armed, half-blind man who couldn't hunt, and kept him alive for decades. They tell us that 31,000 years ago, someone in a rainforest performed surgery on a child and spent years afterward adjusting their entire way of life to keep that child moving. They tell us that wherever humans have been, in every climate and on every continent, the instinct to treat the sick was not a luxury that came later. It was there from the beginning. It may be the most human thing we've ever done. We didn't discover medicine, we were born with it.